So how the cancers, how the normal cell is going to be is converted into or developed into the cancer cell. So normally just now we discussed, so after the development, after the division of the cells, that means the division is going to be is abnormal. So there is no control of the divisions. So because of the cellular adaptations, so it may alter the cell growth and also cell shape and size. So first they're going to be happening in the changes in the DNA. So the genetic material is going to be altered. So the function is going to be divisions and also the shape and size is going to be changed. So after the change must cause an alteration in the cell growth and behavior. So this is the genetic material DNA. So because of the genetic material, so it only controls all the cell functions. So and also the behavior also going to be depends upon the DNA. So if any abnormality in the genetic material, so automatically is going to give the cell growth and also abnormality in the growth as well as the behavior. The change must be non-lethal and also to be passed into the daughter cells. So it's going to be affect to the other cells. So alteration in the more than one gene, so automatically is going to be alter all the behaviors in the cells. So it may give the gene is concerned are is oncogenes, the tumor suppressor genes. So it's going to be affects these genes. The sequence of the gene alteration from the normal to is a benign to malignant. So it's going to be changes into the normal cell, then benign cell is going to convert into the malignant cells. So, and also so many other factors also there is intrinsic and eccentric factors and inherent and also environmental key factors. So many factors are going to be influenced from the normal cell is going to change into the abnormal cells, which is also cancerous cells. So many changes that takes place. Maybe you can learn all these changes, how the changes are going to be happening. So you can learn clearly in the pathology and pathological changes in pathology. So here we are going to discuss about what are the different type of the cancer cell, how this is going to be changed. So how the surgery is going to be, the surgery, how we are going to treat it with the surgical procedures. In the surgery subject, we are going to discuss. So about the properties of the cancer cells. So these are going to be the so many different properties. Just now we discussed he's having the benign tumors and also malignant tumors. So this is going to be two types of unique properties of the cancer cells. So one is the ability to invade locally. So that means it's going to be is occupying to the surrounding structures, is extending, is spreading to the other parts of the body, and also capacity to metastatize to distant size the cancer spreading. So from one place to another place. For example, if anybody get in the cancer in the toe, may chance to get the effect to the brain. So that means it spread to one area to the other area through the bloodstream as well as the lymphatic system. So this is the cells, the main cancerous cells having the ability to like a shift from one place to another place, and also it automatically invade to the main feature of invading. That means it's going to be spread to the other parts of the body. So that is the major like a properties of the cancer cell. So how the spread is going to be happening? So in the benign tumors and also malignant tumors, how the spread is going to be happening. So if you see in the direct extension, so the benign, the carcinomas begins as the localized growth. First is going to get the localized growth, and also direct seeding body cavities or the surface when they arise. So that means first is going to affect to the where is going to be located. For example, it's located in the forearm. So first is going to be affected in the located, and also its surrounding structure is going to be affected. So after that, in the early cancer, do not penetrate the basement membrane. So it's going to be the carcinoma in situ. So that means where the carcinoma started, exactly their place is going to be expanding. So after that, if the cell progression is abnormal growth, from there is going to invade to the other parts of the body. So that means it's expanding to it's spread to the other organs, from other organ and also other site of the body. For example, in the abdomen, from the abdomen it's spread to the other parts of the, for example, liver, it spread to the gallbladder and as pancreas or maybe spleen. But some is going to be this from here is going to affect the lungs. From the lungs is going to be affect to the brain. So it is going to be the distant site, very distant places also is going to spread through the blood as well as the lymphatic system. So when in the situ, the tumor acquires invasive potential extend directly to the compromised neighborhood cells to metastasis. So that's going to be spread to the one part of the body to the other parts of the body. So for example, is a peritoneal carcinomatosis. So and also is going to be the metastatic ovarian carcinoma. So it's going to be the peritoneal is going to be stomach. Again, it's going to spread to the ovarian So it's because of the spreading of the malignant tumors to the other parts of the body. And also in case of the metastatic spread, so metastatic spread means it spreads the transfer the malignant cell from the one side to the another. So not directly connected. So this is going to be effect to the, these properties, malignant tumors, bring them into the contact with the blood and lymphatic vessels. So this hematogenous metastasis and lymphatic metastasis. So this, for example, if anybody having the problem here, so if this is spread to the brain and this spread to the other parts of the bone and liver, kidney, so it's going to through the blood and also lymphatic system. So this type of spread is called as the metastatic spread. So this metastatic means spreads from the one place to another place through the bloodstream and also lymphatic metastasis. So this is the spreading is may happen because of the metastasis. So how the nomenclature, how the name is going to get the tumors, why we are going to call different type of the tumors names in going different. So this is depends upon the involvement of the structure and also depends upon the involvement of the tissue is going to be involved for the cancer. So for example, so any tumors, so any benign tumors, for example, so any tumors is, all the tumors are going to be suffixed with the oma. So oma means like a cancer. So oma to the cell origin. So for example, if it is affects to the papilloma. So papilloma means it affects to the oma. The papilla is going to be affected. The skin is a papilla is going to be affected. So that's why we call it as papilloma. Oma means like a cancer. Is either tumor or also is, so especially for the benign tumors. So for example, the papilla is affected. So the name of the cell is papilla. So the character, morphological characters and also oma. So that's the reasons we call it the papilloma. So these are often known as the warts and also varices and also when they reach to the skin. So that is nothing but extra growth on the skin is called as papilloma. So these are going to be, for example, some examples of papilloma on the skin and also maybe any, and also sometimes we are going to get in the eye regions also the papilloma is going to be increased. So because of these things, it won't give much complications. But if it is occurs in the eye region, so it's going to be occupying the space inside the eye. So it's going to give the further complications. So it may chance to may growth. So it may damage the retina and sclera. So all the eye structures are going to damage. So may chance to get the complications, severe complications. If it is the peripheral regions, for example, on the knuckles, so on the maybe body surfaces, it won't give much complications because of it won't give any compression to the surrounding structures, such as the blood vessels and also in the artery, in the blood vessels and nervous system nerves, peripheral nerves, it won't give much complications. And also you can sometimes it may chance to get in the palate, soft palate also, it may chance to get pharynx and also this papilloma may chance to get, and also in the breast also may chance to get. So many places also may chance to get. So these are some examples of the benign tumors, but it's not, it won't give much complication. If it is there inside the eye or maybe mouth or in something, is may chance to get the complications. So these are the nomenclature will come, the tumors of the squamous epithelium. So is called as the epithelioma. So if the involvement of the squamous epithelium, so we call as epithelioma. Epithelium is involved and also we are adding the oma, epithelioma. And also, for example, if the gland is involved, is an endocrine gland, for example, is a endocrine, is a adrenal gland is involved. So if the adrenal gland is involved, so we call as adenoma, adrenal, so adenoma we call as. And also lipoma, so lipoma and also fibroma, chondroma, osteoma, papilloma. These are some examples of the tumors. So for example, lipoma means the fat tissue is going to become like a rounded structure. For example, this is the line that is a fat tissue is going to become the hard and also rounded structure. It's extra growth. So it's a oma, like a cancer, this is a benign tumor. It's only is going to fat cells are going to be accumulated. So that is an example. That's the reasons we called as this is a lipoma. The fibroma, or fibroma means in case of may chance to get in the breast, in the female, in the fibroid tissues and the breast as well as the ovaries also may chance to get. Is also it won't give much cancerous symptoms, but because of this benign like a characteristics, is going to compress the structures and also it's going to compress the other alter the hormonal balance. So that's the reasons they will get the hormonal imbalance. So it leads to the some other complications, such as they may having the menstrual abnormalities, and also pregnancies, alter the pregnancies. They may won't get the pregnancies. So these may chance to get the other complications. So that's all about the how about the name is going to be related to the involvement structure. That is called nomenclature. How is going to get the nomenclature. So coming to the nomenclature for the malignant tumors, so these are going to be, if it is involved in the mesenchymal tissue, so we call it the sarcomas. So just now we called as the epithelium, we called as epithelioma. So is it related to the in the malignant, especially for malignant, in case of the mesenchymal cells involved, so is called as sarcoma. So if the epithelial cells origin in the malignant tumors, this means spread to the other parts of the body, especially for the epithelial cells, we called as carcinoma. Here in the epithelial cells, what we are calling, in the epithelial cell, we are calling epithelioma. So that means we can understand which one is the benign tumor and which one is the malignant tumor. So if the benign tumor, so that means we are going to call it the epithelioma, but the same thing, if it is the malignant one, we are going to call as the carcinoma. So that is the difference between the benign tumor as well as the malignant tumor. And also name of the origin cell, morphological character, and carcinoma. So that is the carcinoma or sarcoma we are going to give. For example, in case of the malignant tumor of the stomach. So here what we are going to call, so stomach is a gastric. So we call it the gastric is an adenocarcinoma. So it's a adenocarcinoma. So it's going to be affected to the, so that's carcinoma means is going to be epithelial cells are going to be involved. And also is the adenocarcinoma of the stomach. So maybe we can call another name for the gastric, the adenocarcinoma of the stomach is also same. So we can easily understand this is related to the it's related to the malignant cancer. So after seeing this one, we can understand. So that's the reasons the name, the nomenclature. That means that the name is different for the benign tumors and as also is a malignant tumors. And also some special nomenclatures. So we are going to observe in case of, for example, blastoma. So this blastoma means the tumors is ringing in the immature tissue or nervous tissue. So if related to the nervous tissue involvement, so it is called as blastoma. So in case of nerve involvement, nervous tissue is the brain. So that is the reasons. Examples are the medulloblastoma. So and also retinoblastoma, nephroblastoma. So it's related to the medulloblastoma means it's related to the nervous system. It's a retinoblastoma, is the eye is going to be involved, and also nephroblastoma. Nephro means going to be related to the is a kidney. So these are all related to the cancerous cells, and also in case of the brain. So these blastomas are means is going to be ringing in the immature tissue. So these are going to be most often in the malignant. So most of all the malignant in case of retina or nephron and also brain, medulloblastoma. So these, for example, the examples are these tumors are going to be suffix going to be oma. So these are also malignant. But just now we discussed if any oma is there, we thought that we are going to benign. No, some oma is suffix also having the cancerous, that is malignant tumors. So which is the tumors in the liver we called as hepatoma. Hepatoma means is a malignant tumor, but the ending also is going to end with the oma. Normally, it is going to, we can commonly seen in the benign tumors. But some cancerous tumors also, the name itself, it is called as the hepatoma. The suffix is going to be oma. And also melanoma. Melanoma means that's a carcinoma for the skin. That is a seminoma. We call it seminoma. And also lymphoproliferative tumors is also a lymphoma, also called as the Hodgkin's or also non-Hodgkin's disease. And also malignant proliferation of the leukocytes, like the leukemia, like the white blood cells, that is who are having the malignant cancers in the blood leukemia, that's the blood cells, so that is called the leukemia. So these are some different names of the involvement of the structures and also involvement of the type of the malignant cancer, the name will be different. So that's if you understand, so after seeing the name itself, we can understand what type of the tumors. So while assessing while reading the in the investigation procedures, so if we get any report related to this a malignant or benign tumors, at least we have to understand also what type of the a malignancy. And also some other special nomenclatures. So these are going to be this derived from the one from the one germ layer may undergo different differentiation creatings. So it's going to give the different layers are going to be involved. So according to that, they are going to get the different names. So for examples are the teratomas. So these teratomas are rare tumors that may hold different type of the tissues such as bone, teeth, muscle, and also hair. They are mostly found in the ovaries, testicles, and also tailbone, but sometimes grow in nervous system and also abdomen. So a teratoma may be cancerous, benign, depending on its structure. So these are going to be different, like a mixed one. There's going to be, so which layer is going to be involved. So most commonly, so it's going to be seen in the bone and also teeth, muscle, hair also going to be involved. So it's most commonly found in the ovaries in the females and also testicles in the male and also tailbone. So these commonly seen in the nervous system as well as in the abdomen also. So these are the different like a type of tumors we can see and also we can found in the so many people. So that's the reasons we have to understand about the what is the name of the and what is the name of the like a tumors, is it benign or is it malignant.